Okay, this video lecture is going to cover clinical documentation improvement. Clinical documentation improvement is basically making documentation clearer so we can code and bill correctly. While the documentation is the responsibility of the practitioner, CDI helps enhance documentation practices. CDI bridges the gap between clinicians who understand the clinical side and the coding and billing systems by using clear terminology so we can better capture the appropriate reimbursement. In addition to clinical documentation improvement being seen as a financial revenue capture discipline, it also improves medical quality. Physicians are trained how to document from the clinical perspective, but in many cases, they're not taught how to document in order to assign the most accurate procedure or diagnosis code. EHRs have improved legibility and timeliness of documentation. However, it's brought about different problems. These include cloned encounter notes, copy and paste, and other problematic practices. Since 1995, health information professionals have been trying to work with physicians to document A&M services so they can get paid appropriately. But sometimes we haven't focused enough on adding specificity to the diagnosis. This is especially important with such reimbursement models as HCCs and other capitated payment models. Part of the CDI initiative is to review and assist in building structured, compliant EHR templates. One of the pitfalls of the EHR is that it allows practitioners to pull information from a previous visit into the current encounter. We see this a lot with the problem list. And as problems don't always show as resolved, we have outdated or misinformation in the body of the medical record. When practitioners use pick list or favorite list to select diagnosis, sometimes they will select the wrong diagnosis. This was a huge problem with Kaiser Permanente, as we don't have outpatient coders in most regions at Kaiser Permanente. It's up to the provider to use a pick list. So as a result, we have both uncomplicated and complicated diabetes, hypertension as an essential hypertension with hypertensive heart disease, and other things that are not appropriate. This may be due to picking the first item on a pick list, or the term is not specific enough. And sometimes the provider will use an unspecified code, which typically will result in a lower reimbursement. Practitioners are believing that the diagnosis is not really what drives the revenue, that it's actually the procedure codes and the HCPCS codes. However, if you don't have the correct diagnosis code, as most electronic health records actually have you link the diagnosis code with the procedure code, it also affects reimbursement. Therefore, the diagnosis code is just as important. Clinical documentation improvement also supports medical necessity, because if we don't have medical necessity, we can't be paid for the services that are provided. And that's all I have for you. We'll be talking more about clinical documentation improvement in the next video lecture as well. We'll see you then. Bye now.